from the station that's on your side. This is Channel 7 News Daybreak.
Well, you've heard us talk many times about the importance of good sleep on this show because we all need it. In fact, 22 million Americans are impacted by obstructive sleep apnea. Baptist Health's Dr. David Gerson is here to talk this morning about a new outpatient procedure that could cure sleep apnea. Good morning, Dr. Gerson. Thanks for joining us. So, curing sleep apnea, we'll get to this procedure in just a minute, but remind everybody what sleep apnea really is and how it affects somebody.
So, basically what happens is you don't get adequate respirations while you're sleeping. You basically don't get enough oxygen. That comes, you're a loud snorer, you're a breath holder, you're a gasper. You don't get that oxygen while you're sleeping. You're not aware of it. And so you're getting that kind of that damage to the body, and you wake up just exhausted, and during the day you don't have energy, and it creates problems with weight gain, those kinds of things. So it's a relaxation, it's an over-relaxation of the muscles in the respiratory tract, and it's also some signals from the brain that kind of causes some dysfunction.
Really stressing the importance of getting tested.
Yes,
I know there are a lot of different sleep centers around here. I know Baptist Health has one. Once you, let's say you get tested and they say, yes, you have sleep apnea, and the options have typically been a CPAP machine, right? Yes.
Which have also gotten much more leaner, much more, they're easier to use,
compact,
more mobile and compact.
Easier to clean.
But despite that, they still estimate probably 50% of people who have them, who've been given CPAPs, don't use them because they don't like using them.
Okay, so what's this new procedure?
So this is the Inspire. It's pretty neat stuff. The technology has really come a long way, and so it's actually an implantable device. It's an outpatient surgery. They're showing you here, this guy's got a little remote control, which we can kind of have a couple jokes about later. But so there's a little device that's implanted right there under the skin, and then there's a little wire that goes up under your skin up into the neck, where your respiratory muscles are. You turn this on when you go to sleep, you turn it off when you wake up, and what this device does is it's constantly sensing your breathing rhythm, and when it says, oh, hey, he's not taking or she's not taking the breath that's appropriate, it sends messages to the muscles in your throat to start breathing the right way.
Wow.
And so it's shown a significant efficacy. We're talking 80% improvement. The real big one that is really phenomenal is the partners who's you're sleeping, your wife, your husband, your spouse. They're saying, man, this snoring, 90% of folks are reporting that they're hearing no snoring or just very light snoring, and so they're sleeping much better as well.
So who's a candidate for this? Who'd be eligible?
So over the age of 22, that's probably just the testing group that he did. It's a very random age. You got to be reasonable weight. You can't be morbidly obese, and you have to have moderate to severe sleep apnea. And so in that we get that from that sleep study you'll get, which will either be in the sleep center or sometimes you have to do it at home, depending on what your insurance requires.
Okay, so just talk to your doctor about it.
Talk to your doctor. Call the Baptist helpline, and we'll get you set up. It's a pretty neat stuff, and we're doing it in Conway. They just did their first surgery last week, and it's going real well.
Very exciting. Yeah. Thank you so much for coming and explaining that to us. Hopefully it'll help a lot of folks out there because sleep apnea is becoming more and more commonly diagnosed now that we have the ability to diagnose it. Baptist-health.com for more resources, and the Baptist Health Healthline is on your screen.